Hello and welcome to Polypharmacy in the Elderly. This presentation was created by Asia, Christopher, Krista, George, and Kelsey. So what is polypharmacy and why does it impact the elderly in particular? Polypharmacy is defined as the use of multiple medications to treat one or more health conditions. As we age, more chronic conditions begin to surface and affect the way we live our lives. To mitigate these effects, prescribers will typically prescribe medications to combat these negative effects. As more medications are prescribed, the risk for adverse effects and unintended synergistic reactions is more likely to occur. As healthcare professionals, it is our job to protect our patients against these unintended effects.
As it pertains to polypharmacy in the elderly, the management of several medications can be confusing, difficult to organize, expensive, and hard to track. This is even more prevalent in those who are at a loss for caretakers or isolated from others for days, even weeks. With the use of multiple medications, the risk for adverse events is greatly heightened. Some of the common adverse drug reactions are due to metabolic changes associated with aging, reduced drug clearance, and increase in the number of drugs used, and barriers to compliance and/or adherence. As a natural part of aging, our metabolism naturally slows with decreased energy expenditure and causes the drugs to metabolize slower and take longer to reach its peak level. For patients with decreased functionality, adherence to their medication regimen may be difficult. According to the Hong Kong Medical Journal, the high prevalence of polypharmacy and hyperpolypharmacy subsequently increased the risk of suboptimal medication adherence among elderly individuals. This situation can be even worse in elderly patients with decreased functionality, in particular among those with cognitive impairment and dementia. With decreased functionality comes forgetfulness, and it is very easy to forget to take a few medications when you have so many to take. Medication scheduling may also play a role in adherence to a medication regimen for an older adult. According to Science Direct, an elderly patient will be more likely to adhere to medication that is simpler dosing schedule. Symptoms may also affect the medication regimen of an older adult. If the patient is experiencing symptoms that are unfavorable to him or her, that may increase the likelihood of skipping medications. Many pharmacodynamic and pharmacokinetic changes occur with advancing age. As for pharmacokinetic changes, absorption, metabolism, distribution, and excretion of drugs in the body are all affected with age. The intestinal blood flow and gastric acid production is reduced, causing slowing absorption. Gut motility is also delayed, along with delayed gastric emptying because of a loss of neural control. Due to reduction in liver mass, blood flow to liver, and liver metabolic capacity, drugs are metabolized at a slower rate. Reduction in the proportion of total body water and increase in body fat leads to slower distribution of drugs throughout the body. Due to this, the drugs remain in the body longer for older adults since the elimination half-life of a drug is directly related to its volume of distribution. The reduction in this proportion of total body water can also be an increase in body fat, causes the excretion of drugs to be affected as well. Concerning the pharmacodynamic changes, some drugs having low bioavailability can be significantly increased in older adults. Therefore, these drugs should be given in a low dose. The reduction of renal excretion in older adults puts them at risk for drug toxicity. As the older adult ages, there is an altered sensitivity to several classes of drugs such as anticoagulants, cardiovascular, and psychotropic drugs. Elderly patients that take multiple drugs also have the increased risk of adverse effects and drug-drug interactions. A drug that is given to treat one disease may exacerbate another. There are also many food-drug interactions that these patients must take into consideration. The most common foods that interact with drugs are milk, grapefruit, cranberry juice, and garlic. Healthcare professionals have many responsibilities related to preventing polypharmacy in the elderly population. Some common assessments that we will need to perform to assess risk associated with polypharmacy are cognition and fine motor skills that may pose a barrier to proper medication compliance. With many prescription medication bottles having a push-down and turn safety feature, those with impaired motor skills and poor strength may have issues opening these bottles. It is important to assess your patient's ability to care for him or herself. As we age, some patients may experience a deficit of self-care ability. It's important to be aware of cognition and memory barriers that may arise with early onset memory disorders. To ensure that drug toxicity and other absorption issues don't arise, make sure you, as the nurse, are aware of any GI or urinary issues present in your patient. Known liver issues such as cirrhosis and fatty liver disease can affect drug metabolism. Most importantly, the nurse should assess renal function labs such as BUN levels, GFR rate, and creatinine to ensure the drug is able to be excreted from the body. Toxicity can occur if renal function is compromised. In some cases, you may have to talk with the patient's provider on obtaining a serum bioavailability and toxicity screening to rule out a suspected polypharmacy complication related to an accidental double dosing.
One of the most essential interventions you can make as a nurse is patient education. Instruct your patient on possible side effects and foods to avoid while taking this medication. As many patients have had many providers and multiple pharmacies, your role as a nurse is to make sure you know all the providers and pharmacies associated with your patient. Sometimes multiple providers may prescribe medications without knowledge of another provider. As a nurse, it is important to keep an up-to-date record of all known medications for your patient and for your provider to review. If your patient's self-care ability is impaired, it is necessary to enlist the help of a home health care option for your patient who lives alone. Home health care is an excellent option to promote patient independence while also ensuring compliance with medication administration.
Some identified nursing diagnoses or human needs statement in the Nurse's Pocket Guide 15th edition can be as follows. Impaired memory is evidenced by persistent inability to recall if behaviors were performed related to mild cognitive impairment or neurological impairment. Patients with this nursing diagnosis are typically diagnosed with a cognitive disorder such as Alzheimer's or dementia. It is important to note that an extreme cognitive impairment is not a normal part of aging. If your patient exhibits signs of extreme impairment, it's best time to talk to the patient's provider about further testing. Associated with aging, another human needs statement may be the risk for ineffective gastrointestinal perfusion related to gastrointestinal condition, impaired liver function, and renal disease. Those with ineffective GI perfusion usually have a risk factor as defined by NANDA as being over 60 years of age, as well as higher occurrences of those of the female gender. Another human needs statement that may affect the elderly population is ineffective health maintenance as evidenced by inability to take responsibility for meeting basic health practices, or insufficient knowledge as evidenced by alterations in cognitive functioning and decrease in fine or gross motor skills. While assessing the root cause of deviations from medication regimen, it is important to note that those with an identified deviation could have the risk of non-compliance with medication administration.
Our goal as nurses is to achieve an anticipated outcome with our patients. For impaired memory issues, our goal includes the patient's own awareness of memory issues with acceptance. We also want to help the patient establish methods to help in medication administration in a timely manner. There are many options available for remembering medication administration, such as pill timers and per demi containers, pill containers. Lastly, we want our patients to accept the limitations of their condition and embrace resources provided to them. For ineffective gastrointestinal perfusion, we want to perform a focused assessment on the bowel sounds to ensure circulation has improved. We also want to use the teach back method to ensure the patient is aware of GI-related side effects of medication and review proper reporting of symptoms. Lastly, we want to see the increase in health behaviors such as increased exercise. Finally, for ineffective health maintenance, we want the patient to identify factors contributing to the current situation so change can be made. We want to see our patients adopt a lifestyle change supporting our identified healthcare goals. Lastly, to ensure continued compliance with healthcare maintenance, we want to involve the significant other or healthcare team to achieve and maintain these health goals.
There are numerous complications related to polypharmacy that can pose a risk to the elderly population. One of the most common is double dosing or missing a dose of required medication. That is most common with those who may have barriers related to memory and cognitive impairment. With so many medications, the possibility of a drug-drug interaction is always a risk. It is very important to be aware of conditions like serotonin syndrome that can occur with double dosing of SSRI medications. Some medications, such as the drug class of antiepileptics and benzodiazepines, can cause orthostatic hypertension and a slew of other effects such as hypoglycemia and delirium. It is very important to monitor these risks and educate the patient of your findings. Self-awareness is key when it comes to ensuring the safety of your patient. Some instances of psychosis can cause harm to your patient as well as in the form of hallucinations and impaired reasoning that can pose a risk to your patient. Some medications can result in acute urinary retention as well, leading to the risk of toxicity since the drug cannot be excreted as usual. Hyperglycemia can occur mostly with those taking steroid medication. Those who are known diabetic will often have issues of increased blood glucose levels with steroid therapy. One of the most consequential complications of polypharmacy is called metabolic encephalopathy. Metabolic encephalopathy affects the brain and results in altered personality due to chemical imbalance in the blood. The risk of this occurring is increased when another health issue is present that affects blood chemistry.
There are many things that the patient must be educated on when polypharmacy is in play. Staying consistent with one pharmacy is very important. The patient should also always take medications exactly as prescribed. Educating the patient on every medication given is important, and always to make sure that they have an understanding of it. This will limit any risk of drug interactions. Not only should the nurse educate the patient, but the patient should also educate the nurse and or doctor with any behavior changes, pain, dizziness, or negative reactions. The best resource for a patient experiencing polypharmacy is their primary care physician and or pharmacy or pharmacist. If the patient is experiencing any problems, they can report them to their doctor, and he or she can figure out what is causing the problem and take the patient off the medication, switch, or adjust for a safer option. The pharmacist can also offer the patient some education on what is causing the reaction. There are several ways to decrease the odds of polypharmacy in the elderly. The first and possibly the most important is to get the family, patient, and entire caregiving team involved in the patient's current and previous medications. From here, reorganizing medications and reconciling medications can be more effective, thus minimizing the risk for polypharmacy errors.
Okay, and that is the end of our presentation. Thank you.